Some doctors are now identifying what may be a new symptom of coronavirus, COVID toes. Dr. Lamont Tyler, an urgent care now medical doctor, joining us this afternoon. Doctor, what is this? And is this more common in adults or children?
Actually, it's more common in children and young adults. It's a relatively new skin manifestation that we're seeing now being linked to COVID-19. It was originally recognized in Italy when Italy was dealing with this a few months ago, and now we're starting to see a few cases here in the United States. But it tends to be a relatively early symptom of COVID, of patients infected with the COVID-19 virus.
Okay, and can you describe it, a type of lesion then on people's feet?
Yeah, actually, it tends to start off as a relatively discoloration, more of a purple or kind of bluish discoloration. It may be associated with a burning sensation or a tingling sensation, and sometimes can actually trigger some blisters or ulcerations on the toes and feet as well. But it's pretty much limited to the feet and the toes and the hands and fingers.
Wow. Have there been, that you've seen, a rise in this COVID toes recently, or is this like fairly new within the last few days?
This is actually a relatively new finding, probably within the last week. What we have seen, we know the typical symptoms for COVID-19 tend to be more respiratory, with fever, cough, and ultimately shortness of breath and respiratory symptoms. But what we've seen over the last month is that patients are actually starting to have other type of symptoms, such as loss of smell, loss of taste. And I would include here the COVID toes as probably being another one of those symptoms. What we recognize that has mostly been seen in younger children, younger adults and children. So typically those who have pretty much intact immune systems are the ones that we're seeing this, but more to come, more to be known around this. I think what we're really focusing on is why is it happening? And if we look at other viral illnesses that have occurred that we're familiar with, such as the flu, we recognize that a lot of viral illnesses can sometimes trigger inflammation in the smaller blood vessels. And that inflammation can sometimes trigger these type of symptoms, but sometimes it could diminish blood flow and oxygen supply to these extremities that typically have smaller blood vessels, and that can also trigger a clotting sensation as well. So once we have a better understanding about why this has been associated with this, we'll know more. But it's not uncommon. We've seen other viral illnesses in the past that have had what we would call skin or dermatologic manifestations, and I'm not surprised that we're seeing something relative to COVID as well.
All right. They do say that this disease changes over time. So thank you so very much for your time today, Dr. Lamont Tyler. Please keep yourself safe, and we appreciate your time again.